Patients receiving treatment for snake bites have appealed to the federal government and other political office holders to prioritize the donation of essential medical drugs to hospitals rather than distributing motorcycles as empowerment items. They made the call while speaking with journalists at the Snake Bite Treatment and Research Hospital in Kaltungo, Gombe State. Trust TV's Adamu Imam completes the report.
The Snakebite Treatment and Research Hospital in Kaltungo local government area of Gombe State was established to treat snakebite cases, conduct scientific research, train medical personnel, and educate communities on how to reduce the risks of snake bites. However, patients receiving treatment at the facility say the high cost of anti-snake venom and other essential drugs is making recovery difficult. They are now calling on government and political leaders to provide medical support to ensure quick and effective treatment. I was attacked by a snake while I was harvesting my sesame in the farm. I have spent 4 days on admission. The treatment of a snake bite is not easy. We can't afford it unless we raise contributions to pay the bills. I appeal to the government or politicians to remember us. Instead of buying motorcycles as empowerment, they should come and save our lives with anti-snake drugs. The cost of anti-snake venom ASV has risen sharply in recent years, with the vial now ranging from 45,000 naira to over 55,000, making treatment unaffordable for many rural patients. I was walking with my friends when I got a bite on my leg. Immediately we lit a lantern and saw a snake running. Then we killed it outright. It's been about 6 days now. Honestly, the drugs for treatment are expensive. When they told me it was 250,000, I felt it. But I thank God I'm recovering gradually. The head of the hospital, Dr. Nicholas Haman, disclosed that about 70% of snakebite victims treated at the facility are rural farmers and children from Gombe and neighboring states. He noted that delayed access to treatment remains a major challenge, stressing that snake bites require urgent medical attention to save lives.
Protective against coagulopathy, and also is more protective against complications. However, PANAF has been found to be very weak in those areas. Another research that we're able to do, we're able to look at the snake bite among pediatrics, which is we analyzed 723 cases that we saw in 2024, and we found that majority of our bites, 60% of them occurs in the hand, rather than the conventional information that goes around that most of the snake bites occur on the lower limb, that's the foot. Also, a very interesting finding that we're able to find is that we discovered that patients that purchase anti-snake venom are more likely to die than those that got it free. The interesting part of it is we discovered that those people that receive anti-snake venom free were able to receive it within 30 minutes to 1 hour of admission, while those who had to buy, they spent up to like 7 to 8 hours, some of them even up to 24 hours before they were able to gather money to buy this anti-snake venom. Because before them to gather, of course, they are low socioeconomic class patients, from low socioeconomic class, farmers, headers, and all that. So they needed to do some level of contribution, lease their farms, sell part of their farmlands to be able to buy this anti-snake venom.
Also speaking, a ward head at the hospital, Christiana Yakima, shared her experiences in handling snakebite cases, describing the condition as one that demands prompt and specialized care. We actually advise that after a snake bite, people should not run at the beginning because it causes the poison to spread faster through the body. We also inform them not to tie the affected area with a rope as a first aid measures before reaching the hospital. It can have negative effects. All we need is for them to rush the patient to a medical facility. That's what we always advise. Dr. Haman also appealed to non-governmental organizations and philanthropists to support the hospital by providing anti-snake venom and other essential drugs for free distribution to patients. He emphasized that timely intervention remains the key to saving lives, especially in rural communities where snake bites are most common. Adamu Imam, Trust TV News, Kaltungo.